Once again, what Xavier was saying, the building has been really crazy, so we have many colleagues that was involved in that, and we are happy, and this is happening today.
This is actually really inspiring, and I feel like this is mostly a matter of people. How can you bring people together, but also how can you solve people's problem in the present, but also in the future? Because I think we have lived COVID era, or maybe we are still living it, but we may not know it. Today, what type of work are you doing actually in care, but more generally in Institut Pasteur de Dakar?
I'll let Xavier go a little bit more into care. At the Institut Pasteur de Dakar, the main work we are doing is aligned with our mission, which is really to accelerate access to health, but an access that is equitable, affordable, and which is sustainable. That's really what we're trying to do in Africa, in Senegal, and at the global level. What this would mean specifically, it means that we will be working on trying to understand problems, whether it's an infectious disease epidemic or a pathogen that is causing trouble, through research. Once we understand that, we would be really willing, actually using that know-how to put together public health measure that would support that, meaning that doing surveillance, once we know how it works, and making sure we can respond to outbreak, and making sure in a third pillar to be able actually to train people and building that next generation. And that's why the care issues is very important. But what we've also noticed at Institut Pasteur de Dakar is we can understand the problem, we can put some measure in public health, but you would need tools, what we call medical countermeasure, vaccine, diagnostic, therapeutics. That's why we build a whole industrial operations where really we're making vaccines, we're making a diagnostic test, and on all that we focus on the local priority. So linking together this capacity to generate knowledge, to set up impact through public health, to make product, to train people in an ecosystem that will be a continuum of activity that will be able to face problem in local community is really our obsession. It's really about going to the community, understanding them, detect any threat, and respond it first. Making sure we have the next generation of people that would play and transform the society in this regards. And making sure that we are manufacturing for equity. We are obsessed by this equity thing, because we believe everybody have the right to have a productive lives and healthy lives. This is particularly true because that's where we're coming from. So that's really what we do in general at IPD, and I would leave to Xavier to talk more about care.
Excellent.
Yeah, so we have a very catchy way of summarizing the value proposition of care. We used to say we would like to turn pain into gain. So really turn diseases into value and exploit this transformative power of diseases to create value, companies, prototypes, new organizations, new software, etc., etc. So for us, it's really a place where people come, and when they leave, they are different. Different because they have learned, different because they want to change the world, or just different because they have failed, and this failure has been transformative. And we are very keen on mixing the flavor. So Amadou was evoking earlier the anthropology with AI and mathematics, and one of the first course that will be organized inside or under the auspices of care is scientific diplomacy. So how could we use science and healthcare in general to root the peace in this part of Africa? If you look around on the map, we are surrounded by some threats or some countries being at unrest, and Senegal is really an island where you have peace, where you have youth, where you have dynamic growth, and this needs to be preserved because it is the social and political conditions for development. And we believe that as scientists, as people being engaged into the healthcare and the health of people, we have to contribute to this process. And one of the key outcomes we would like to create out of care is that we are, let's say, the return on investment is not only monetary, but it's also promoting great ideas, attracting great people, having fun, having some disruptive ideas. And being in Senegal is a bit remote from the top scientific place, like in the US, like in Europe, like in Asia. But we have a lot of peace, we have a lot of time to think, and also we have a lot of problems, and these problems are inspiring. So we believe we are at the right place to deliver the next generation of entrepreneurs, the next generation of visionary people, and possibly the next generation of diplomats or people who can act on the policy making, on the global healthcare development, and also on the economy of this part of Africa. So this is a very, very exciting moment for us, and I think for the whole Institute.
Let me expand a little bit on two different points, if you allow me. On what Xavier was saying, connecting the ideas are critical. So that's why we picked at least 5 topics on which we think people would gain on being educated, whether it's about coming here to learn core capacities in microbiology, biosecurity and things, and epidemics, because not epidemic in the sense on the technical part, but the logistic, the coordination, how do you talk to the press, on digital health and data science, which is really what he's passionate about. I'm sure he may have opportunity to talk more about it. On entrepreneurship, because we believe any brew innovation should find its way to the market to be impactful to people. So we want to teach all those innovators and people how to become good entrepreneur. And the last piece is biomanufacturing. How do you make a vaccine? How if the pharma is not interested by a disease which is neglected here? A local company can have the people trained to be able to make it as a diagnostic or as a vaccine or maybe one day a drug. So I'm just bringing those because these are things on which we want to be a little bit more focused. And the last piece is care is a lot about response. How do you respond to an epidemic? Today, one day you hear about Mpox, you hear about Marburg, the next day you hear about COVID. And all this need to have a sort of setup where you can deal with those situations, and that's why we are equipped here with a situation room to do that. And my last piece is what Xavier has been extremely good is to attract people from around the world to come and share what they know here with people. We have been privileged in having course and activity organized here by MIT in the US, who is one of the world's best engineering school. People from NIH, one of the world's best place where you can learn science. People from Africa CDC, all Oxford University. I mean, all sort of group are coming here, and being this platform where people network is critical, and it has to be put a bit to the credit of Xavier and his team.
Senegal has become the first African nation to achieve international certification from the World Health Organization, WHO, for the deployment of an emergency medical team, EMT, abroad.
First, I've been very well aware because yesterday I was supposed to join the celebration of that, and this is a sort of tribute to the work that people have been doing for years here in intervening, and particularly this is given to our army, where you have a medical branch which is extremely active. So beyond the pride this gives to me, at the professional level, I mean, there is 3 comments I want to make. First, for 1.5 years, I chair at the global level the partnership that are dealing with epidemics. And that specific emergency medical team, I've been one of the point I was pushing very hard to make sure it happened, because these are the people that would deal with during epidemic with patients, making sure that while they're helping, they're not actually getting infected. So really a matter of priority and saying something that we pushed very hard that is happening. The second comment is it gives us the opportunity to show exactly what CARE is trying to do. If you give the local capacities the opportunity to learn, then they can work at the international standard and be relevant locally while playing a role at the global level. What we call global is exactly that's where you would build it. Take the best expert, make sure they learn together, and then bring a WHO, which is about norm, to certify what is done is at the right standard. And the last piece is collaboration. When we talk about the future, this group, we have been very much involved with them in bringing our mobile lab to support them during operation and exercise. And it's become a resource for all of us. So that's why I'm so proud, but very enthusiastic about what we can do. And we should also actually congratulate WHO because they support this, and we are proud in Senegal that the hub of WHO for Epidemic is here in Dakar, and they are fantastic collaborators to IPD. We host several international reference labs by WHO, Africa CDC, most of them in the field of epidemic. So for us, it's a huge milestone, and we're so happy that's happening around so we can collaborate with them.
And just to add on what Amadou was brilliantly explaining, the R and the E of care is about resilience to epidemics. And resilience is not something you can buy or you can get, it's something you construct. And I think through the past collaborations and synergy with the mobile labs, we are also involved in simulation with all these teams of medical and military doctors. And not only it is a pride, but I think it's a huge opportunity to be connected with WHO, but also with the Senegalese army, the healthcare departments of the Senegalese army, but also to have here within care a room which is called a situation room where we could coordinate, connect, and simulate and practice.
What does frugality mean for you?
One thing that is important is the reflection we have on frugality is when you can do a lot with very little. That's our vision of things. What it means if you translate that if our daily work, if today we do a diagnostics, we know that we're going to do it in a remote area where there is not necessarily electricity, water is not that available, and it should be as sophisticated as the same thing you're using in Stanford or somewhere else. So thinking scientifically how to make the same result with less is what we call frugality in our area. A common friend of ours is really focusing on frugal science, was really today he built a microscope with $2. And he used that to train people, where he can do centrifugation with like $1 sort of things, just using ties and things. So for us, this part is absolutely important. I was mentioning earlier, we need to be connected to communities. If you work in a community where $1 is something they would prioritize in terms of use, saying, am I going to buy food or am I going to do the diagnostic tests? The lower is, in terms of cost, the science, the better it will be for that community. So anticipating that when you do science, when you do innovation, is, for me, what is really, really critical to take the science to be impactful. And that's exactly what actually Xavier was saying about turning disease into values. Today, we have to work in the communities that are the poorest in the world, and with the idea we get from there, the sample we get from there, we are actually doing something that is literally changing the world. So that's what frugality is, something I can comment on.